Counseling the post-MI patient, a clinical guide to bedside empathy and guideline-directed medical therapy. This is Dr. Asifullah from KMUIMSKDA cohort, and today we will discuss the consultation architecture according to standard guidelines, Phase 1, Phase 2 and Phase 3. The event, counseling the patient and explaining hospital procedures. Phase 2, the medical plan, securing adherence to the life-saving medications and emergency protocols. Phase 3, the road ahead, managing lifestyle, cardiac rehabilitation and psychosocial care. The empathy loop establishes trust. You assess baseline knowledge through asking, then you deliver information by telling, and then you verify comprehension by asking again. Validating the trauma prevents the physician from talking over the patient's head. For example, you say, I know the last few days have been incredibly scary and overwhelming for you and your family. You have been through a major medical event. Before we talk about the plan, can you tell me what you understand so far about what happened to your heart? Translating pathology with the plumbing analogy. Plaque building with plaque rupture and clot and complete blockade infarction. You tell the patient, think of blood vessels supplying your heart like pipes. Over time, plaque build up on the walls of pipes, and recently a piece of that plaque ruptured, causing a clot to form. This completely blocked the pipe, starving a part of your heart muscle of oxygen, and that is what caused your chest pain. You demystify the coronary intervention and tell the patient to fix the blockage. Our cardiology team went in with a tiny wire and placed a stent. A stent is like a tiny metal scaffolding that pushes the plaque aside and props the artery open to restore blood flow. Your heart is now getting the oxygen it needs, but the muscle needs time to heal. Now that the artery is open, our number one goal is to keep it open, and that requires specific medication plan. The SAAB core regimen. Statins, antiplatelets, ACE inhibitors are ARBs, beta blockers. So statins reduce inflammation and stabilize plaque, and you tell the patient that statins stabilize the plaque in your artery so that it doesn't rupture again. Antiplatelets prevent stent thrombosis, may be used for 12 months, and you will tell your patient makes your blood slippery and thin so a clot cannot form on the metal stent. You must not stop these without talking to a cardiologist. ACE inhibitor or ARBs, they prevent myocardial scarring and pathological remodeling. You tell the patient that ACE inhibitors or ARBs prevent your heart muscle from scarring and changing shapes. Beta blockers reduce cardiac workload and chronotropic demand. You tell patient that this medication acts as a shield for your heart, slowing your heart rate. So you tell your patient what you are doing. It is better to have these medications by your side so that you can tell from each catch cover what is the use of each medication. The 5-minute nitroglycerin decision tree. You tell your patient that if there is familiar chest heaviness or shortness of breath at home, you stop all activities, sit down, rapid cough, and one nitroglycerin tablet sublingual. Wait for 5 minutes, and if pain is still there, call your emergency number 1122 in Pakistan, 911 in any other place, and the second tablet while waiting for ambulance may be taken. Never drive to the hospital by yourself. Accidents can happen and overspeeding can kill you. If pain is gone completely, rest and take your other medications on their time. Mandating cardiac rehab and risk modification. The bridge to normalcy. You tell your patient, I am prescribing you to cardiac rehab. It is an outpatient program where exercise physiotherapists and nurses will monitor your heart while you exercise. The safest way to rebuild your strength. Lifestyle interventions, 5 A's. Ask, advise, assess, assist, and arrange. You ask the patient to quit smoking because quitting smoking cuts the second MI risk by 50%. Patches, gums, or other medications may be prescribed if the patient is having difficulty in quitting smoking. DASH diet or Mediterranean diet focusing on lean meats, olive oils, vegetables, and fruits, and avoiding fried, processed, packaged foods with added salt. Healthy BMI and no or moderate alcohol intake. It's better not to take alcohol. Practical life recovery dashboard. Intimacy 1 to 2 weeks post MI, when the patient can briskly walk up to flight of stair without chest pain or severe shortness of breath. Fatal warning is not to take any sildenafil or Viagra because nitroglycerin has a dire severe hypotensive effect when taken together with these medicines. Typically, they cannot drive for 1 to 4 weeks and longer for commercial heavy truck drivers. Must consult local DMV or DVLA rules. For work, return to work in 2 to 6 weeks heavily depends on the physical demand of the job. Screening for the hidden psychosocial complications because depression actively worsens cardiovascular outcome. Mental health overlap is a core clinical metric that requires active screening. 20% prevalence of post-MI depression is there. So you tell your patient having a heart attack reminds us of our mortality. It is very common to feel depressed, anxious, or angry. If you find yourself unable to sleep, crying, or losing interest in things you love, please tell me. It is a normal reaction to this trauma and we can help you through it. The post-MI WARD checklist, empathy established and plaque or stent explained without using jargon. DAPT compliance stressed, crucial for stent patency. Statin and platelets, ACE inhibitors, ARBs, are beta blockers as used by patient, explained to the patient. Nitroglycerin 5-minute rule and call to emergency medical services. Referral for cardiac rehab, smoking cessation, addressed if applicable. Return to life timelines discussed like sexual relations, driving, and work, and addressal of post-MI depression and anxiety validated. This checklist should be ticked before discharging the patient on home care. That's all. Thank you very much.